Post-traumatic growth has been on my mind a great deal for the last several weeks. I've gone through, like many of you, a pretty significant life trauma, and I was wondering, what do I do with it? I certainly need to grieve. I need to be sorrowful, but could I potentially grow from that experience? And this concept of post-traumatic growth sits very well with me. Not just with me, but philosophers have talked about it for centuries. That what defines life is not how many traumas you've gone through, but what do you make of them? How do you grow from them? So I found this impressive study on post-traumatic growth that I'll tell you more about it, and then we will try and make sense of it and do some deep learnings from it. So this study appeared in 2023, interestingly, in a journal of trauma and emergency surgery. And it's a lot of patients who experienced major physical traumas, polytraumatized patients from Germany at a level 1 trauma center. Perhaps we should start with a deeper understanding of what is post-traumatic growth. And it refers to positive personal development that can occur following severe stress or trauma. And it's not really defined at all in DSM, which focuses on disorders. But post-traumatic growth in many ways is the right order of things, which is if you're exposed to a challenge, not only can you recover, but can you potentially grow from it? Let's do a deeper dive into that, shall we? So these were the findings. Check it out. Even in patients 20 years after polytrauma, significant traumas, 19 out of 20 of them actually report major positive changes. In other words, even if trauma happens to your life, our destiny is not to stay traumatized. Many of us, in fact, the majority of us, especially if we give it some thought, actually get something out of it. That's growth. That's a positive change. More than 1/3 of patients, because of their trauma, actually had an increase in appreciation for life. 20% not only had improvement in their psychological strengths, but pretty high improvement. They in fact converted their traumas into a sign of strength and a sign of resilience. On top of that, there were improvements in relationships that occurred as a direct result of the profound trauma they had been exposed to. I've had someone tell me once, they were telling me, Rakesh, never let a good crisis go to waste. I couldn't understand what they were saying, but now I do. A terrible trauma, a moderate trauma can in fact often teach us the importance of relationships. And just look at the numbers here. 4 out of 10 patients, in fact, reported increased connections with people, more trust with people, better long-term psychological benefits. They felt stronger because they overcame adversity. And this was seen in all kinds of individuals. There are some challenges. We'll talk about who are some of the people who don't get great post-traumatic growth. But let's also appreciate that trauma doesn't have to become destiny. In fact, the destiny of humans is not just to recover from traumas, but to in fact strengthen because of the traumas we have been exposed to, including appreciation of life. So appreciation of life is really enjoying and relishing the positive aspects of existence and key aspects of growth, such as experiencing and recognizing the true worth of life, expression of gratitude. Those all, in fact, can be gifts from the trauma that we're exposed to. And not taking things for granted. That's another, often a major gift, if I may phrase it, of trauma. And by the way, high degrees of trauma exposure are not a barrier to experiencing post-traumatic growth. All of us, no matter what level of trauma we've been exposed to, can in fact experience post-traumatic growth. And our minds can be open to new possibilities, really as a result of the traumas we've been exposed to. About 1/3 of patients reported that their attitude shifted in the positive direction because of their traumas. They found themselves to be more resilient. They approached relationships differently with a more open mind. Optimism, social support, resiliency, if already present before trauma, can only aid in post-traumatic growth. But even those who are low on those factors can in fact hope to achieve, in most situations, greater post-traumatic growth. So personal strengths can certainly grow up, but spiritual changes can happen too. And by that, I don't mean religion necessarily. I mean spiritual change. So what is spirituality? Which could be religion, but it often is appreciating there is a greater reason than our own selves for the existence of humanity, of relationships, of this world. And many individuals after trauma really start thinking about it, and in fact use that to benefit themselves and their relationships, and as a result move closer and closer to achieving greater post-traumatic growth. Interestingly, older patients tend to report higher levels of post-traumatic growth. People in stable long-term relationships also same, though even if someone is single and not in a stable committed relationship, they too can have post-traumatic growth. Female patients, in fact, exhibited greater post-traumatic growth, and injury severity was not a barrier. So for all of the reasons that I'm showing you here on this slide, please don't feel that the doors to post-traumatic growth are closed to any one of our patients or to ourselves. The door is really open to all of us. This is a SWOT analysis. I think you're familiar with it. SWOT analysis of post-traumatic growth. The predictors are, well, the way I would put it is, I don't find anybody automatically to be denied the possibility of post-traumatic growth. Certainly there are threats. If someone has very high levels of anxiety or depression or PTSD, that can serve as a barrier. Therefore, treating insomnia or anxiety, depression, PTSD can only help a person get to their goals of post-traumatic growth. But the good news from this slide really is PTG, post-traumatic growth, can be destiny for the vast majority, if not hopefully for nearly all patients we see with this condition. So long-term psychological effects can be quite profound. This German study that I've referenced before, was looking at the lives of people 20 years after their traumas. And there doesn't appear to be a point where post-traumatic growth evaporates. Many individuals can not only obtain the help of post-traumatic growth, but they can retain it for long periods of time. Social support certainly helps. So if you're a family member or a friend or a therapist or a clinician to someone undergoing PTSD, guess what? Our presence is important. We definitely do have to treat the PTSD, but to direct the patient gently to appreciating post-traumatic growth is a possibility, and here's some directionality to how to achieve it, would only be, if presented well, will only be received well by our patients. So in conclusion, post-traumatic growth is in fact common. We should not be nihilistic or negative about that. Vast majority of individuals can achieve it. Some individuals are luckier than others in the way that just having age and wisdom helps. Being female helps, being married helps. And interestingly, more the injury, psychological, physical, seems like greater the chance the person can achieve post-traumatic growth. But let's also appreciate the door is not closed to anybody. Everybody is welcome into the kingdom of post-traumatic growth. Multiple areas of improvement occur in individuals: appreciation of life, realizing the worth of health, confidence in relationships. There's some things that lag behind, such as spirituality, personal strength appreciation, but certainly they can be held in that direction. And of course, much more research in post-traumatic growth needs to happen. But this is how things get started, right? By you and I and others having a conversation in this. So with that, I thank you very much for being part of this personal exploration of post-traumatic growth, but also a professional conversation about how we as clinicians should really expand our vocabulary, not just to be people who treat symptoms, but hopefully help people grow into their true selves. Trauma is not destiny. Healing is destiny. Growth is destiny. Let's make sure we never forget that. Goodbye for now.